If you've ever been told to just watch and wait, but fibroids keep getting bigger and bigger, if your bleeding is heavier, your pain is worse, or you already had surgery and they came back, you're probably asking one question: why does this keep happening? Today, we're talking about why fibroids grow and why they keep coming back, even when you're doing everything right, because fibroids do not grow randomly. Greetings, I'm Phyllis from Pong, fibroid and hormone health expert, holistic nurse and coach, creator of the Unique Holistic Program. My team and I help women like yourself transform their internal health so they can naturally shrink and eliminate fibroids, restore hormone balance, and heal womb conditions without relying on short-term solutions like repeated surgeries or medications. Because true healing isn't about removing symptoms, it's about restoring harmony. When women come to me, they're often frustrated. They say, I eat clean, I exercise, I go to my doctor's appointments, I followed instructions, I even did the surgery. So why are they still growing? You see, because fibroids don't grow from the outside, they grow from the internal environment. Your body is not just a uterus, it's interconnected systems. Hormonal communication, detoxification pathways, inflammatory signaling, circulation, nervous system regulation. When those systems become imbalanced, the body creates conditions that favor growth. I want you to think of your body like soil. If soil is inflamed, depleted, toxic, and stagnant, weeds thrive. You can cut the weeds, but unless you restore the soil, they grow back. Fibroids are the weeds. Your internal terrain is the soil. Surgery removes the visible mass, but it does not automatically change the estrogen metabolism, inflammatory signaling, detox capacity, cellular nutrient status, your mindset. Many of us are operating on a day-to-day that may not be cultivating our well-being. Surgery does not change that. And if the terrain remains the same, the body repeats the pattern. What actually feeds fibroid growth? This is where we need to go deeper. Number one, chronic inflammation. Fibroids are influenced by inflammatory signaling molecules in the body. Inflammation can be driven by poor gut integrity, processed foods, blood sugar instability, environmental toxin exposure, chronic psychological stress, trauma. Long-term inflammation alters hormone receptor sensitivity and tissue behavior. So fibroids respond to that environment. Hormones and fake signals. Think of inflammation like static on a phone call. Your hormones are trying to send clear instruction, but inflammation adds noise. Now your hormone receptors can't hear properly. They misinterpret messages, they overreact, and fibroids respond to that confusion. Number two, estrogen dominance and impaired metabolism. See, fibroids are hormone-sensitive growths. When estrogen is dominant, meaning there's excess circulating estrogen relative to progesterone, it creates growth supportive state. But get this, sis. Estrogen dominance isn't just about producing too much estrogen. It can also mean impaired liver detox pathways, poor estrogen clearance through the gut, high body fat percentage, exposure to xenoestrogens in plastics and cosmetics, chronic stress suppressing progesterone production. So the issue isn't simply high estrogen. It's estrogen that's not being properly metabolized and cleared. Number three, sluggish lymphatic flow. One system that is almost never discussed in conventional care is the lymphatic system. As a nurse, I never understood how important the lymphatic system is. The lymphatic system supports immune balance and waste removal. It's like your sanitation system. If lymphatic flow becomes stagnant due to sedentary lifestyle, chronic inflammation, dehydration, stress, waste products, and excess hormones are not efficiently cleared out the body. Number 4. Nervous system dysregulation. If you're living in constant fight or flight mode, your body prioritizes survival, not reproductive balance. Chronic stress elevates cortisol. Elevated cortisol interferes with progesterone. Progesterone helps counterbalance estrogen. So stress indirectly influences fibroid growth. Stress is not just emotional, it can be biochemical. When you're told to watch and wait, nothing about your physiology is changing. No one is evaluating inflammatory markers, any micronutrient deficiencies you may have, your liver detox efficiency, progesterone levels, cortisol rhythm, even your insulin resistance. So what exactly are we waiting for? Monitoring growth without addressing the environment does not change the outcome, sis. This is why we use functional lab testing. We don't guess, we assess. Hormone metabolites, inflammation markers, thyroid patterns, nutrient deficiencies, cortisol rhythms, detoxification pathways. Because when you have data, you have direction. Once we understand the internal terrain, we shift it. Cellular nutrition is not about dieting, vegan diet, keto diet. It's about supplying the body with what it needs at a cellular level. So reducing inflammatory signaling, support liver detox pathways, stabilize the blood sugar, rebuild progesterone efficiency, improve mitochondrial function. When the environment changes, growth loses reinforcement. Key takeaways. Here's what I want you to remember, sis. Fibroids do not grow randomly. They grow in response to internal conditions. Surgery removes the tissue, not the terrain. Inflammation, hormone metabolism, stress, detox, and nutrient status all matter. If nothing changes internally, reoccurrence risk remains. If this helps you understand why fibroids may still be growing, subscribe and turn on your notifications.